Yes, gentleman in the back.
I'm Damon Arnold, the director for the Illinois Department of Public Health, but I have one question, and it's one of the problems we face in public health all the time. And, you know, if you were looking at treating HIV, it becomes AIDS, and you start treating someone and they have no access to medications, it costs the healthcare system in this state at least $50,000 per year for direct medical care costs. Over an 8-year time period is $400,000. And one of the problems we have is that we don't really have the perception of things that are being, when you put interventions into place, that you sort of eliminate the downstream appearance of a disease. And so people think that there's nothing wrong and that you are preventing things from happening. Have you done anything around economic modeling to show how much you actually save a government, an organization? I'll give you one more quick example just to focus a little bit more. But if I had an accident on a highway going to downtown Chicago, if there was no one there to take away the cars, I would, for all intents and purposes, I would stop businesses from happening. I would stop the transport of goods in and products out. So we are, by doing that, you actually stifle the economy and may have economic impact that is just staggering. But by taking paying someone to come in and to remove the cars actually frees the system and allows you to have a much better economic outcome. But we don't really measure those things. But by doing what you're talking about, you're actually helping governments, and you're actually helping their sustainability.
Yeah. This is let me be provocative here for 1 minute. In medicine, if there's rapid death, there's the greatest cost savings. So we could say the best thing to do is to let people die, and then we don't have to worry about their downstream costs. But there are several very important elements here, and that is that there is great instability, political instability in the world. And that political instability, at the heart of that instability, I think, is inequity. And the greatest inequity is health inequity. And so, if we think of the world as a whole, what is really, really great for this world is a world in which people share the benefits of science and advancement in society equally. I know it may sound a little bit Pollyannish, but I also think this creates stability. Every time I go to the airport, I'm saying to myself, why do I have to take my shoes off and practically undress? Because there's instability in the world just to get through security. And the cost of that is unbelievable. If you just look at the Homeland Security budget, for the first time ever, it got cut in this round, and it got cut very little. You realize how much we're spending because there is instability. I think that an investment in equity in healthcare will pay off in the long run in a better world, and with a more efficient expenditure of limited resources that the world has. If you look at population by itself, one of the biggest challenges for developing countries is lack of control of population growth. So it's very hard to actually provide for a population that's growing faster than its economy can possibly grow. What's been observed for all time is that if you improve child survival, amazingly enough, you would think intuitively the population would grow, but actually the population goes down. So, there are equalizing forces that allow the economy to grow, a healthier population, a greater sense of stability in the world, and I think that's why we make the investments we do. You could take any disease and say, well, maybe we shouldn't treat these people, but in the end, what is it that we're gaining? and what is it that we're losing. And that's very hard to model through any kind of economic model. Because the best economic model would be everybody dies quickly, we never have to treat any chronic disease, and then costs are very restricted.
Well, I feel compelled to end on that because it was such an eloquent and deeply thought statement. So I want to thank Dr. Yamada most of all for helping us to conclude this day so thoughtfully and range across so many issues. I want to thank all of you for being here today. We have come to see Chicago as among many other things, a great global hub for the issues of healthcare, and we intend to try to help move that hub down the road. Thank you all for coming, and join me in thanking Dr. Yamada again, please.